Hi class, glad to be back. I hope you guys are too. So we're gonna start our lectures back up. Let's take a deep breath, relax, and let's get started. We're in chapter 10 on venipuncture procedures. Here are the chapter objectives. So let's start out with the equipment that you'll need for routine venipuncture. So you're going to need your collection tubes, needles, your holder, tourniquet, alcohol wipes, or iodine wipes or swabs, your gauze sponges, band-aids, tape, or your Coflex wrap, your sharps container or needle disposal unit, gloves, and syringes. Okay, first things first, remember to wash your hands. Hands, you guys, are one of the dirtiest things around, okay? You ordinarily have microorganisms that can colonize on the human skin, okay? So it's very easy to spread these microorganisms from patient to patient and even from the patient to yourself or yourself to the patient. So it's very, very important that you wash your hands. You want to use soap and water always if available. However, if all you have is the alcohol sanitizer, you can use that and wash your hands with soap and water as soon as you can. Now, just because you're going to wear gloves does not mean that you don't need to wash your hands. You need to wash your hands before your encounter with the patient, after your encounter with the patient, and you also need to wear gloves. You should wash your hands for at least 15 to 20 seconds and make sure that you're scrubbing between the fingers and cleaning the back of the hands as well as the palms. Also, it's a good rule of thumb to let the patients see you sanitize your hands. This will help them have more confidence in you as well as alleviate some of their anxiety. The blood collection procedure, you want to identify your patient. Make sure you do not just say their name. You want to ask them to state their name. You can ask them to spell it for you and ask them to also state their date of birth. Remember that patient identification errors are avoidable, and try putting yourself in the patient's shoes when it comes to being misidentified, okay, and someone either drawing blood or performing any other type of procedures that were meant to be performed on someone else. So keep that in mind. Patient identification errors can be very costly and also cause a lot of mental anguish for the patients. You want to check your lab requisition. Make sure all the information is filled in on the requisition. A good rule of thumb that I like to follow is if there's a question and a blank, you need to address it in some way, whether it's not applicable to the patient or if the patient states they do not know the information. You need to address it in some way rather than just leaving it blank, okay? It's a good idea to get familiar with the lab requisitions at whatever facility you're at so that if you have any questions beforehand, you can ask your supervisor or someone of other lab personnel any questions you have about the requisition beforehand, before getting in front of the patient and then, not knowing what to ask or how to ask or why this information is needed. Because sometimes patients, when you're asking them questions, they'll ask you, what do you want to know that for? What is that information going to be used for? So it's a good idea to familiarize yourself with that so that you can, appear professional and be able to answer the patient's questions. Then you're going to find your suitable venipuncture site. You want to remember your order of veins. Collect your sample in the proper container, and this will be following your proper order of draw. You're gonna, I'm sorry, I skipped a step. After you find your suitable site, you're gonna prepare your equipment, then you're gonna prepare your patient and the puncture site, cleaning it properly in the circular motion, not going back and forth over the site. Then you're gonna perform your venipuncture. Make sure you collect the blood in the proper container following your order of draw. Then you're going to assess any possible complications, any need for a resample, such as if you did not get that tube filled properly, or you suspect there was something wrong with the vacutainer itself. And then you're going to label your collection tubes at the bedside or in the presence of the patient. And then you're going to immediately send these specimens to the lab along with the lab requisition. Please put the lab requisition in the bag at the time with the lab specimen. Do not just lay your lab requisition back on the stack and plan to, put them all together in the end. You want to keep everything together at the time and assembled, packaged properly in the presence of the patient. Okay. Also keep in mind if any of these are time specimens or stat labs, which need to be done right away so that you are able to stay on top of those things and get them to the lab properly and timely. Okay, needle sticks. It just takes one mistake during these venipuncture procedures to puncture yourself. Prevention of needle stick injuries. Needle stick injuries that occur immediately after an injection are more likely to spread disease caused by bloodborne pathogens. Needle sticks from trash piles may cause injury and infection from germs in the environment. And some ways that needle sticks may occur is through recapping used syringes and needles. And this is something that you never want to do. You do not want to recap needles. Many of the needles now have the safety device on the needle that you can just use to push over the needle. Needle sticks can occur when carrying used syringes and needles. You want to make sure you dispose of any used needles right away. Do not sit them down. Do not attempt to hold them in your hand while you're putting other things together. For example, while you're putting the specimens in the bag or something. You want to make sure you have that sharps container right near you and available to drop those sharps immediately after you have performed the procedure. Insecure positioning of the patient, particularly children. You want to make sure that you have an adult, the parent or a guardian, or your coworkers, whatever the situation may be. You want to make sure that children are properly secured and their arms and stuff are properly secured so that when you perform the procedure, they're not moving or able to swing their other hand or arm, which can cause dislodging of the needle and possible needle stick to yourself or unintentionally to the patient. Disposal practices that leave syringes and needles accessible to the public or to grazing animals. Now, hopefully we don't have any grazing animals in any facilities, okay? But this could happen if you work in a home health or hospice situation where you're out in the community at the patient's homes. There's a big problem with this when it comes to patients as well who are diabetics and have to give themselves insulin injections. So if you're ever in situations like that, you want to make sure that the patients have adequate and proper disposal containers available to them as well. And make sure that you never throw any sharps into the trash can. Also, never throw needles. I've seen people attempt to throw the needle into the sharps container. Do not do that. You do not know where that needle is going to land. We're not pro basketball players. It is not a goal. You simply drop the needle into the sharps container. Okay. Also, never allow your fingers to go down into the sharps container. I've seen people do that as well. You want to hold that needle upside down and just drop it. Okay. Also, another thing on the sharps containers, make sure that if your container looks like it's over 3/4, over 3/4 the way full, you want to get a new sharps container. Do not attempt to put or force sharps into a container that's already over half full. Okay, and then we already talked about a little bit about the lab requisitions. Here's just an example of a requisition. Now, most facilities now will have the electronic requisitions, so you'll follow suit the same way. The only difference is it will be, contained in an electronic device, either handheld tablet or laptop or something like that, okay? But same thing applies. You familiarize yourself with that requisition. Make sure you have all the necessary information, that patient's ID, whether it's male or female, ethnicity, date of birth, and any other of these questions that need to be answered, okay? Here's an example of the order of veins. The first vein you want to attempt, the most common and the preferred vein is your median cubital vein, then your cephalic vein, and then as a last resort, that basilic vein. For your blood collection techniques, again, you want to make sure you're following the proper order of draw. Also, with your tourniquet, make sure that you don't leave it on longer than 1 minute. And I also want you guys to notice the hand techniques, okay? You need to familiarize yourself with your equipment and be able to make smooth transitions from one thing to another with the equipment, such as stabilizing your equipment and pushing the vacutainer into the needle at the same time. Because if you don't do this, if your technique is bad, when you push that vacutainer into the needle on the back end, you're going to also be pushing that needle further into the patient on the front end, which is going to can cause injury to the patient, as well as you're going to go straight through that vein. Okay, so you're not going to get a good sample, and then you're going to have to do a restick. Here's another example of a vacutainer technique. And also, you want to make sure that you have a clear view of your container the entire time so that you can see when the blood is flowing and has stopped flowing. Here's an image of collecting with the butterfly. And then here's an image of collecting with a syringe. Okay, that's all I have for you guys today. For your assignment, I want you to list some of the physical dispositions that patients can have that may affect the blood collection. You can find some of these in your text on page 320 to 322. And I will see you guys next lecture. Don't forget to be awesome.